I'll be honest with you in regards to like when the last time I went to the dentist. Prior to my tooth falling out and needing an emergency crown, it had been at least 3 years.
Oh my gosh, Steve.
During the pandemic, a lot of us postponed our appointments.
Yeah.
Mine went back too far. I still can't blame the pandemic for all of that. But now that COVID is winding down, really time to pay attention to your overall health, and that includes your oral care.
Yeah, that does. A hiatus in dental care can have lasting consequences. TCL reporter Kristen Hobrecht talked with the president of the American Association of Endodontists about what we can do to help get our dental health back on track.
We know our teeth play such a huge role in our lives, helping us chew, talk clearly, also our appearance and giving us confidence.
Yeah.
But with the pandemic, we know that so many people, we were quarantined and they probably canceled appointments or postponed treatments. From your perspective, what did you notice about how the pandemic played a role in oral care?
You know, it's a great question. We had a survey that we sent out as part of our association survey. We interviewed patients, and we found that 1 in 3 were eating more sugary snacks during the day. It was probably the access to the snacks, yeah. Like you. 1 in 5 were not brushing their teeth in the morning. They didn't have anywhere to go. And then 1 in 2 were not making regularly scheduled dental appointments, so they were not taking their good care of their teeth by going to their dentist. And what that leads to, obviously, is a greater risk of getting cavities. And some were just afraid of going to the dentist. So fortunately, now that the pandemic is coming, we hope, to an end, patients are more comfortable coming in. We're seeing patients that are getting their regular dental care, and they're identifying some things that probably could have been taken care of a little bit earlier, and it's keeping us busy.
Help explain the main differences between a dentist and someone like yourself, an endodontist.
Sure. A general dentist that goes to at least 2 more years of dental school can be an endodontist. And we specialize in treating any infection that starts inside the tooth but can cause pain or swelling if it's not taken care of. Endodontists also have specialized equipment like surgical microscopes, 3D imaging of the teeth, and a lot of technical instruments that make the treatment more efficient and more comfortable for patients.
When should they see an endodontist?
Well, the classic reasons patients come in is because they have pain or swelling. So typically patients that have pain will have prolonged pain to hot and cold, pain to biting on a tooth, but sometimes they don't have much pain and they have a lot of swelling. And sometimes they don't have any pain or swelling, but they go to their dentist and their dentist sees a deep cavity on one of the x-rays, or if they have bone loss at the end of the root, they may say you need to have a root canal treatment, and they may refer the patient to an endodontist.
I understand your wife is also in the dental field. She's an orthodontist.
Yes,
is that right?
I met my wife in dental school.
Okay.
She needed a date to the dental school formal. Actually, maybe I needed the date. And she took pity on me, and the rest is history.
Yeah.
We started dating our 3rd year in dental school, and then I specialized in my endodontic training, and then she became an orthodontist, and she actually works in our practice up here. I was a psychology major before I went to dental school, so understanding the fear the patients can have, the anxiety, all of those can make the patient more likely to have discomfort during their treatment and experience and remember more pain after the treatment. And we've actually focused in the last 7 years on research of predictors of pain after dental treatment, and one of the best predictors of pain, of course, is coming in with pain, but also having a lot of anxiety and fear. When a patient finishes up with treatment, it's so important to give them expectations of what they're going to feel the next few days after the treatment. So they're going to leave and they're going to be numb, and that's going to be great. They're going to think this is wonderful, particularly if they've come in with a lot of pain.
Sure.
But it's likely they're going to be a little tender in that area afterwards. So we recommend taking over-the-counter medications, and that is extremely effective after the treatment. So ibuprofen in combination with Tylenol can be very effective. About 5% of the time, patients might need more than that, or they might get some swelling, and then we're here for them. If they want to give us a call, we're happy to see them.
For more information on Dr. Law and the American Association of Endodontists, you can head to TwinCitiesLive.com.
And just say endodontist.
I felt so empowered right there.
Endodontist.
Pronouncing it right.
It's powerful. It's
that
a great
was a really good feeling.